QAH Pulse radio show, brought to you with a kind compliment of MedSafe Medical Supply.
Blessed good morning to everyone listening here with us on Q100.7 FM CBC Radio. Thanks for joining us for another edition of the Pulse Radio Show. I'm your host, Shane Seeley, Communication Specialist at the Queen Elizabeth Hospital. Always a pleasure to be with you on a Monday morning. This is kind of like the halfway point, or I should say we just passed that, for Season 3. Last week we focused on colon cancer and building awareness around that. Of course, that happens for the entirety of this month, and I will share with you some of those events coming up surrounding colon cancer awareness. Of course, salute to the Caribbean Colon Cancer Initiative for many of these events that they have planned throughout the month. And of course, we'll be reminding you so you can go get that information. And of course, if you want to hear that episode, you can also go back to our podcast, which is available on our website. That's www.qhconnect.com. Also on our website, you will see that we would have published, and we spoke about this over the past couple of weeks, we would have published the 2025 to 2028 strategy for the Queen Elizabeth Hospital, led by our Chief Executive Officer, Neil Clark, supported by the executive team, the entire staff of the Queen Elizabeth Hospital, and the public as well, because the public had an opportunity to have their input at what was a public town hall. So that is available. A media release will be sent out today in relation to the publishing of that strategy, explaining why this is an important moment for us in transitioning to the action of the strategy. So a lot more to come on that. And then we have also on our website and on our YouTube channel, you can just do a search on YouTube and find the Queen Elizabeth Hospital and all of the content that we have there. Our latest submission from the Barbados Canada Foundation. They continue to support us wholeheartedly, and they will be doing that this year through Bring On the Spring 2025, where they're trying to raise funds yet again to support another equipment drive at the hospital. So you can go on our website, the link is there for that YouTube channel, and you can go directly to see how you can be a part of that initiative by supporting the Barbados Canada Foundation. Whether you're here in Barbados or in the diaspora, you can be a part of this new thrust to support the Queen Elizabeth Hospital in getting better together. That's our slogan, that's our mantra, and that's what we're about, getting better together. And speaking about getting better together, you know, we're focusing on that again today. That is the crux of this series, and it's one of the scourges which is facing our nation that our team at the hospital, our committed team led by this gentleman, they're trying to help us find a solution and really try to turn around the situation, but the responsibility lies on the patient. So I must welcome our special guest today, Dr. Michael Krimholtz. He's a consultant at the Queen Elizabeth Hospital. He's a diabetes specialist and endocrinologist. Thank him for spending some time with us today. He has a very busy schedule, but he carved out some time for us here on the Pulse Radio Show to answer your questions. Dr. Krimholtz, welcome and thank you for joining us.
Thank you for having me.
We appreciate your time. And the person who would have made sure that this was a reality, my good friend, nursing officer, a specialist diabetes nurse, Deborah Knight. If you come to the clinic, the outpatients clinic at the hospital, you would see her helping many patients on a daily basis. I really want to salute her for her commitment, because I had to really take her out of her clinic this morning to come and spend some time to share her knowledge, her wealth of knowledge, coming from both ends, of course, Dr. Krimholtz and her. For those of you living with diabetes, those of you, fighting that battle, and really we want to help you to win. And those of you who are edging close to it, we want to help you to turn around that situation as well. Nursing Officer Knight, great to have you on this show, and thank you for spending some time with me.
Thank you for having me, Shane.
Yes, so remember those numbers to call, 434-1007 and 434-1070. There's also that option of sending us a WhatsApp at 434-1007. For the hospital, this is a very important topic because of what is seen in the outpatient clinic and by Dr. Krimholtz on a daily basis. When I tell you these are two very, very busy individuals, and to have them here is very important for the Queen Elizabeth Hospital, but very important for our messaging to help those of you be a bit more proactive as far as your health is concerned. You may hear some stories that you may not want to, that you may not believe is reality, but diabetes is a scourge that is plaguing our nation, and in many cases it's because of how we are living, how we are eating, how we are, our lack of movement, our sedentary nature that has gotten worse over time. Dr. Krimholtz, and you've been seeing it firsthand. Talk about your experience here in Barbados. Talk a bit about yourself, what you do as a diabetes specialist and endocrinologist, and your journey at the QEH. Give us a bit of background on you.
Well, let me answer that question in reverse. Obviously, I'm a consultant physician, so my background is medicine, but my specialty is diabetes and hormones. I've been at the Queen Elizabeth Hospital for 21 years, where one of the first things I did was to set up the diabetes clinic.
2 decades and one.
Yes, and there was no diabetes service at the Queen Elizabeth Hospital when I went there, so I had to set one up from scratch, and of course I didn't do this on my own. I did it by training up some excellent staff, of which Deborah was one of my first to come through. I now have an excellent team of 4 nurses who really are amazing. In some ways I'm a fraud. They actually do all the heavy lifting and I just sign the prescriptions on their behalf. So they really do know what they're doing.
They make your life easy.
They do. Strange enough, to this date, we're the only specialty in the whole hospital that has a nurse-led service, because they really do know their stuff. They know a lot more about diabetes than a lot of the doctors who are supposed to be writing the prescriptions. We haven't got as far in Barbados as nurses writing prescriptions yet, but my goodness, they know what they're doing. So I'm very lucky to have a talented pool of staff to make me look good when actually they're doing all the work.
Wonderful.
The rest of the time I work as a consultant physician in the hospital, so yes, I'm on call in the accident emergency that I'm sure you're hearing lots of complaints about. But last time we counted, which is about 10 years ago, we published a paper showing that 42%, between a third and half of the patients in the hospital, are there for diabetes.
Wow.
The vast majority of those are there for complications of the diabetic foot. All of this should never be in a hospital. Diabetes properly should be managed and can be managed outside of hospital. So when it's dominating our workload as an inpatient specialty, which is the most expensive way to treat people, but they say $1,500 a day to be an inpatient, and patients are spending weeks and even months there with the complications, particularly the foot, but also kidney disease and the associated problems of diabetes, strokes and heart attacks and even heart failure, all related to diabetes, and fill up our hospital, and it's the worst way to treat diabetes. The way to treat diabetes is to manage it on an outpatient basis, both in primary care and in the clinics. We shouldn't be seeing all those people in our hospital.
Yes, I know that the Ministry of Health and Wellness is trying to work to build awareness, and not only that, but to ensure that we can have more of these diabetes patients going the right direction, as you said, managed outside of hospital, taking some of that load off of the Queen Elizabeth Hospital. You see a number of patients, Nurse Knight, in your clinic, and I must admit I always have very regular conversations with Nurse Knight about what she sees that may be a bit startling for her in terms of trying to help people manage their condition, but a lot of people tend not to listen, and that's why they end up back at your doors apologizing for not following the regimen. Talk a bit about your work now, especially with our patients. You see many of them one-on-one and really try to help.
I think, Shane, our biggest challenge is changing behaviors. Changing behaviors are difficult. It is good to say we want you to eat healthy, each portion control foods, but if foods are expensive, if living a healthy life is above where you can actually get, that's where we have challenges. But you would also appreciate that a number of our patients are on a lower socioeconomic background, and many of them are on welfare. So when we tell them to eat healthy, we have to look at it at the perspective that healthy incorporates not only looking at diet and exercise, but looking at the other variables that prevent them from getting there. If you can't afford to pay your bill, if you can't afford to pay your rent, how can you then think about eating healthy? If you can't afford to send school your child, how can you think about eating healthy? So we have to attack all of these other issues before we can get a person to think about, okay, let's me address getting my blood sugars to target. So a number of things go into getting patients to change their behaviors. But I think I need to start there. Yes, lifestyle modification is vitally important in managing diabetes, but we also need to look at the other things that go into managing it as well.
I think it's worth pointing out that the patients that Deborah and I see, by definition, are the ones, patients where things have gone wrong.
Mm-hmm.
Psychosocial issues are a big deal. For various reasons, people can't comply with a medication regimen. They can't follow the guidelines. All those people who do, by definition, wouldn't be seeing us. If you're admitted to the hospital with diabetes, by definition, that's a failure of management. Should never get that far.
Talk a bit about, on this series, these episodes that we have gone into season 3, we've been really trying to help people focus on putting their health first, being more proactive as far as their health is concerned. What are some of the, and I really want to get to this early before we start getting some calls, what are some of the simple things people can do? I had a friend recently, early 40s, and he was diagnosed with either pre-diabetes or diabetes. He changed his lifestyle, and then he went back to the doctor, and the doctor is saying, he was able to kind of reverse that state.
We do diabetes reversal. At the moment, we've got 75 ex-diabetics, but we've got 3 times as many still diabetics, but very well controlled through the diet programs we run.
Mm-hmm.
But that is not people like your friend are not the kind of people that would come to our service. We're dealing with the tough problems. In answer to your question, what can people do? First and foremost, take your medication. It works. It's been proven in huge clinical studies with tens of thousands of people to work. A lot of the problems we see, and it's embarrassing how many people we see who for one reason or another have not got their medication. Yes, you feel well, and we're asking you to take medications which may very well have side effects, to take them on a regular basis to stop you getting unwell. So yes, when your repeats come up every month, yes, you have to go and get them. If you find that a pain, queuing up to get your medications, you might be surprised to find that quite a few of them are really very inexpensive, and it wouldn't cost you that much to go to your local pharmacy and pay for them. But never let yourself run out of medication. That's where things go wrong. Secondly, look at what you eat. If you are overweight with type 2 diabetes, which is not everybody, but it's the majority of the people we're seeing, look at losing weight. Everybody knows how to lose weight. The difficulty is keeping it off. Mm-hmm. So there are very simple things you can do. For example, cut down the amount of meat you eat. Meat is our highest form of calories. It's also where we get our cholesterol from. It's also the most expensive thing we eat. And if you just want to add an extra one, it's the most environmentally unfriendly food that we eat. Get your calories from vegetables. Get your proteins from beans and pulses. You've got no cholesterol. You save money. You save the planet. And you get better yourself. It's a win-win. I'm not saying you all have to go vegan out there, but you could cut down the amount of meat you eat. You can make a chicken breast last all week if you just have a slither and make up your plate with vegetables. You save money. You're helping the local economy because our vegetables are local. Try avoiding eating things in packets. The imported stuff, again, good for the environment, but the stuff in packets, by definition, is full of ultra-processed chemicals to try and stop them from going off. Those are the things that we now have identified in the last 5 years as being drivers to making you eat more and overeat, because ultra-processed foods don't make you feel full the way fresh food and vegetables do. So try to avoid things in packets, cut down your meat intake, and then finally, cut down your flour intake. Flour is digested to be only one step removed from sugar. So all that pasta and bread, everyone forgets about pasta. It's not just bread and pastry, right? cut out the flour. Think of alternatives. If you can have rice rather than pasta, or brown rice rather than white rice, or better still, have ground provisions. Get the same calories, still get full, but don't eat the foods that are going to turn directly into sugar. Those things can, if they don't help you lose weight, will stop you gaining it. Yes, you will have to go on a diet from time to time, and yes, there are drugs. They're very expensive drugs that can help you, but we can't put everybody on a Ozempic. But for those who do lose weight, those lifestyle changes are good at keeping your weight off. Thirdly, walk more. It's not that hard. You don't need to. You'd be amazed how little exercise you need to do to keep yourself out of the clutches of people like Deborah and me. A 10-minute walk every day can literally halve your chance of getting diabetes if you have pre-diabetes, and is frankly as good as any medicine that we can prescribe. Just a 10-minute walk around the block is almost as good as most medicines we can prescribe, but certainly for early onset and overweight people with type 2 diabetes.
I have a smile on my face because when I think about some of the things you're saying, it makes me feel guilty. It's almost like a guilt trip in terms of your diet. But you know what? We're going to talk a lot more here on the Pulse Radio Show about diabetes as we put the spotlight and get you on that path to better health. We'll take a break right here. Of course, the Pulse Radio Show brought to you by our friends at MedSafe Medical Supplies Limited.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Welcome back to the Pulse Radio Show. I'm here with Dr. Michael Krimholtz, consultant and diabetes specialist, also endocrinologist, and nursing officer Deborah Knight. She's a diabetes specialist nurse. Great to have them on the program. Before we go to Nurse Knight about her advice for you, those of you who come to her clinic, you may hear it from her, and you know she may be knocking on your door trying to tell you, listen, you need to do this, you need to do that. I want you to listen. You need to listen to these two specialists because this information is so critical. We have our first caller for the morning. Welcome to the Pulse Radio Show. How can we help?
Good morning, sir.
Good morning. How are you doing?
Yeah, good morning, Shane. How are you?
I'm all right. I'm here smiling inside because I feel guilty about hearing some of the things that I should not be eating that could affect my blood sugar and such like, and I need to do better for myself, and I want everyone to try to do better for themselves as well.
Most of us are guilty.
Yeah.
Because we find ourselves eating this and eating that and things that we know that we should not be eating or drinking or for that matter, abusing.
Yes.
Yes. Good morning. It's Dr. Krimholtz, right?
Krimholtz,
right?
Krimholtz.
Right. And Nurse Knight.
Yes.
Yeah, good morning to you, and thanks to Kim Lee for putting me through. Sir, I want to commend you and say thanks to you for coming to Barbados and setting up a diabetic clinic at our hospital. I think that you should be recognized for that. You know, it is very, very, very. It is a very good thing that you've done for us, and we all should appreciate it. But now, I have a question. I want to ask you about policy of doctors in general. Now, I heard you mention something about prescriptions. You mentioned how great your nurses are, that they can even deal with. Should be. I think you said that they should be able to deal with prescriptions because they are that good in your area. But I'm thinking about this. There's something I want to find out from you as a consultant. If I am an ordinary doctor in your area, in the diabetic clinic, and I wrote a prescription, and I made an error on the prescription, can another doctor like myself, an ordinary doctor like myself, say to me, Dr. So-and-so, I don't think that's right, you should change that? Or can only a consultant do it?
The answer to your question is doctors make mistakes all the time, and we have systems in place to try and mitigate that. For a start, if I write a prescription and I make a drug error, that's got to go through a pharmacist who hopefully is a safety mechanism to make sure that you get dispensed the right stuff. And if I wrote a stupid dose, if I'm seeing 20 patients and put a 0 on the end and gave you grams instead of milligrams, that wouldn't, I hope, get past a pharmacist. So we do recognize that we're human, so we do put measures in place. You do not need to be a consultant to prescribe diabetes medications. It is true there are certain medications that are really very expensive, but they're not the majority of what we do. And people on those medications probably should be seeing a specialist, and there are certain drugs that can only be prescribed by a specialist to start with. There are mechanisms, but nobody's used them. They do exist, that if I start a medication up, it can be continued in the polyclinic using a system called the Category B drug. Nobody I know can remember the last time a Category B drug was dispensed in the polyclinics, but I am working with the pharmacy at the hospital to see if we can reinvigorate that process so you don't have to be coming to hospital for your medications, because that's wrong. If we start medication up, you should be able to get them at any public clinic. And most of the medicines we use, let's be honest, are widely available and inexpensive. You hear the horror stories all the time about polyclinics running out of medications. The number of times on which that's actually true is vanishingly rare. And even if medications do run out, it's usually only for a day or two. And there are usually alternatives that can be used to tide you over. So I'm a great advocate. I don't want to be writing all the prescriptions for 40,000 people with diabetics. That would be ludicrous and impossible. So yes, all doctors can prescribe diabetes medications.
Yeah, but you see what I'm getting at, right? You see, yes, I understand that. Yes, a pharmacist can recognize something and give a doctor a call. You see, but a pharmacist, if you decide to give me 100 milligrams of something, the pharmacist does not know why you are giving me 100 milligrams of something. The pharmacist would not know if that is too much for my position.
Oh, they would. If it was if you needed 10 milligrams and I wrote 100, a pharmacist would be able to pick that up. It's more that if you needed 10 milligrams and I gave you 15, those minor errors, which are rarely dangerous. So those safeguards do have a practical purpose and they do work. And the point I was making earlier on is not about doctors and medication, it's patients and medication. Most of the problems are not actually the doctors and the medication, it's patients not taking their medication.
Yeah.
It's something like a third of the people that show up in our A&E are there for some reason that they didn't get their medication, didn't take it, spontaneously changed the dose because they mistakenly believed, folklore like I'm not eating, therefore I don't have to take my medication, or the blood sugar was good, therefore this is nonsense. You need to continue to take your medication. So yes, doctors make mistakes, but patients make them much more often.
Yeah, I know sometimes you have to put a relative to take medication. I know sometimes you have to supervise, but I was wondering if it is unethical in your practice for an ordinary doctor to suggest to another ordinary doctor, hey, something is wrong with the prescription.
No, it's not unethical.
Okay, sir. Thank you very, 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 very much.
And thank you for calling. Your question is important, and we appreciate your call here on the Pulse Radio Show. Nurse Knight, I wanted to come to you on the back of what some of the advice that Dr. Krimholtz shared there with our listeners. Talk to us as you see patients. What are some of the things you find that you keep saying all the time?
They say, I don't know what to eat. I don't know what to eat. You tell me don't eat rice, you tell me don't eat potato, you tell me what to eat, nurse. And that is a recurring decimal for the majority of the patients I see, because they get the information from other sources which say, I can't eat rice, I can't eat sweet potato, I can't eat English potato. So everything they hear, you have to debunk, because everything is either shrouded in mystery. So what we then do, we go through how to actually look at carbohydrates and starches, and I tell them which is low in carbohydrates, which foods are high in carbohydrates, which to stay away from. For example, stay away from cokes, they love Coke, and I will tell you the majority of my patients, they will have a Coke hidden in their bags, and then they will tell me, nurse, my blood sugar good, this is only when my blood sugar drop. But indeed, it don't drop.
I can guarantee Deborah will find it if you've got a Coke in your bag in our clinic.
I will find the Coke. So they will come with Coke, and then they say, a ginger ale and sweet as Coke. But then I tell them, do you know how much sugar is in a ginger ale? And then I go through serving sizes and how much. So if it has in, let's say, 32 grams of sugar, they say, nurse, it's 32 and a lot of sugar. And then I tell them how much sugar is actually in 32 grams of sugar. And then I would look at it from a tablespoon, a teaspoon, and that's how we actually go about teaching them all about carbs and how much carb is actually in what they eat.
So sodas are out of it.
Sodas
you should cut out sodas.
All sodas. We will tell them drink soda water, and then the issue is with the Viva waters, and we tell them the alternative would be the Viva water, soda water, and then you have Crown water. Now, Crown water, the small one, is 8 grams of carbohydrates. Well, the bigger one is 16 grams. So 16 grams is 2 servings for the Crown water. So then we go through step by step by step by step, and then they get a better understanding in terms of actually looking at labels, because they don't understand labels. So they pick up and tell me, well, nurse, I don't understand what the labels mean. And then we start to go through what it means on the labels, what to recognize, how much sugar is in what. And when we start doing that, persons appreciate what they actually do when it comes to eating. In terms of exercise, many of our patients hate exercising, they hate moving, and for our overweight patients, you would appreciate if you start to walk, they experience pain in their knees. So I would tell them, think about swimming, if they can pick up swimming, because when you're in the water,
you're buoyant.
And those are other ways. So we try to incorporate moving more. For our elderly patients, we do chair exercises, and we teach them chair exercises in clinic that they can actually do, so that way they're moving more, and we incorporate even the broomstick in their exercises. So there are a number of things that you can actually do within your own environment to move more, and also to recognize what you're actually putting in your mouth.
Cardiovascular movement is important, Dr. Krimholtz?
Yes, but I'll come back to what I said earlier, supporting what Deborah says. The amount of activity you need to do is surprisingly small. There is, for example, no evidence whatsoever that going to a gym will help you lose weight or improve cardiovascular outcomes, mainly because you can't get enough people to do that kind of activity for long enough. We can all think of a few individuals who've lost weight, but there are no big, large clinical studies using a gym. There are plenty of clinical studies looking at walking, because you can get large numbers of people to walk. If you can't walk for 10 minutes, or walk for 5. If you have arthritis, go and see a doctor and take the painkillers to enable you to walk for 5 to 10 minutes. You'll find at the end of the day you've gone a whole lot further, and chances are you're probably going to live longer too.
Indeed. We have another caller here on the Pulse Radio Show. Welcome, caller. How can we help?
Good morning. Peace be unto each and every one. A blessed and a spirit-filled Lenten season to you all.
Appreciate you. How are you doing?
I'm thankful for life. I don't know how I would like it, but I'm thankful. I want to salute your very important and distinguished guest. Doc, I am from the bottom of my heart. I too, like the gentleman, thank you so much for coming to my country and caring for our people. Thank you so much, and may the Creator continuous blessing be upon you and your nurses. Nurse Deborah, I absolutely, and well, I should say you are absolutely and perfectly right in what you were saying about when you first started to talk about persons who, cannot afford certain things, and it is true. Now, they tell us we must eat properly. But when the things that you have to go and buy, now a pensioner, or as you say, persons on welfare that have to look after their children, when the light bill and water bill, that is half of the pension money, then you might have for the lumber or the lumber yard or whoever. When you finish those, sometimes there ain't nothing much to go in the supermarket with, and then the things that you're supposed to eat is very expensive. I thought the budget there that some of the things probably would have, come down, but it still is tough. Another thing I heard you spoke about, Doc, is that persons who need prescription, they have to pay bus fare from St. Lucie to the hospital to get a prescription, and I am glad that you should be able to get a prescription in your district clinic instead of have to be trekked all up at the hospital to get.
But remember, if you're a patient at the hospital, you have the medication delivery service.
Yes, I know that. I know that. But
I would also go.
But suppose the person don't have the money to get it done.
There's an answer to your question, ma'am. With the exception of specialty drugs, which is a small minority, I know the eye drugs are at the hospital only, and we are looking at that. And I've been talking to people, senior pharmacists, about other ways of doing this.
Okay.
But when it comes to most medicines, and that applies to nearly all, except for very few of the diabetes medications, a QEH pharmacy prescription will be honoured at the polyclinics.
Okay.
And so what I tell my patients, I have an afternoon clinic, and it routinely runs after pharmacy is closed. So rather than tell people to come back the next day, I tell them to take their prescription to their local polyclinics. And if you don't like the look of the queue at the QEH pharmacy, which can be long, you can take that prescription to your local polyclinic. So I don't agree that you necessarily have to take your bus fare into Bridgetown and back just to get medications. A lot of them, there are a few, I accept that, but that is really a tiny minority. So for most people, most or all of your medications can be obtained at your local polyclinic. Coming back to your thing about food and expense, if you wanted to invent the perfect food for diabetes, you would invent the breadfruit. How cheap are they if you got a tree anywhere near you?
To me, the breadfruit is too sweet. I prefer the cassava, the yam.
But you can't pretend that they're expensive. We eat much more expensive things than breadfruit and cassavas and yams and sweet potatoes.
Breadfruit expensive? You paying $10 for breadfruit, sir?
Well, you've got to find a friend with a tree. That's what I do. I have a friend with a tree, so I don't pay anything for my breadfruit. And pickled breadfruit, you can't do much better than that, can you?
Shane, thank you so much for the podcast, because sometimes you hear a program and you would like to listen to it or send it to your loved ones overseas, and you cannot find it. But I must take my hat off and to salute you all at the hospital, because it don't take long for you to find the podcast. So thank you very much for that.
You're welcome.
And the machine, the number machine, is out of service.
Yeah, we're working on that. We're working on that. But I am very shocked. I'm shocked that you can't find the breadfruit.
I got breadfruit, right? So, breadfruit's all around here. They got breadfruit, right?
Oh, so you don't mean you mean some people. You don't mean you mean some people might go pay $10 that don't know where to find it.
It is too sweet. It is for me. It is too sweet. And I had went to a diabetic a lecture, and the gentleman said that they're having sugar too, so it's best to use the yam and cassava and things that.
All right, so listen, we got the leading specialist in diabetes in Barbados here on this show, and he says, is breadfruit okay?
Breadfruit's okay. I think the confusion, everything by definition has sugar in it. The only difference is the rate at which that sugar is released into your bloodstream. So sugar, obviously, only 2 molecules is the quickest sugar release they are. Very closely followed by flour, which is why I was saying earlier about pastries and bread and pasta. But the food that has long-chain carbohydrates, what we call fiber, that releases the sugar really slowly, that's fine. You're going to still get sugar, but it's going to be released at a rate at which you or somebody with diabetes can cope with it.
And at the top of the list, what you would say, I like sweet potato, to be honest. I'm a big sweet potato person. I like the orange one. The purple one I'm still getting used to, but it seems a bit more watery, which might not be bad. Which might not be bad.
Carolina.
Yeah. Carolina is the orange one?
Yes.
I love the orange one. It's so soft and nice.
I want to give that name because of a lady who had a where you would call it a brothel in the city, and he named that after her. She was a beautiful woman, as far as I understand.
All right, we can take a break on that note. You can stay on the line, I think, and we can come right back with some more on the Pulse Radio Show.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
We got a lot more to talk about as far as diabetes is concerned on the Pulse Radio Show. That's why we're putting the spotlight on this condition, and we are helping you on that path to better health with Dr. Michael Krimholtz, a specialist in the field, a diabetes specialist, the leading consultant at the hospital and in Barbados, and also with us our very special nurse Knight. She's a specialist as well, our diabetes specialist nurse. You heard that conversation a few moments ago, talking about the foods that are slow releasing in terms of sugar, and then those that are really some dangerous ones. At the top of the list, sugar itself, and then you have things like sodas and other quick releasing foods. But please, in terms of your diet, and I'll let Dr. Krimholtz go back to that, talk about some of the foods that we can eat that would help us to promote better health, and in terms of portion sizes as well, maybe you can explain how that works.
Okay, well, you're touching two of my favourite subjects. I'm a keen cook, so food and diabetes obviously intimately related. You'd be amazed how much time I spend in the clinic getting recipes from the patients, right? So I learn things from my patients too. Yes, vegetables, no cholesterol, lots of fibre, good for the environment, good for your heart. I mean, come on, you can't. Even things that might seem sweet, like beets, for example, and sweet potato. I've never understood why, but apparently a sweet potato sugar release is the same as an English potato, even though one tastes sweet. But then you get the worst possible. I said you want invent the best possible food. Try inventing the worst one. Try inventing macaroni pie.
Oh,
I'm sorry, if you got diabetes, that's birthdays and Christmas only.
So you heard that.
Yeah.
Macaroni pie for those of you living with diabetes, birthdays and Christmas only. And I would like them to reduce it at Christmas, because when you say Christmas only, they might think every day during Christmas. And then I remember that surge that we had in that late January, early February period in A&E, where we are now seeing the results of the bad eating practices during the holiday season. So macaroni pie once on Christmas Day, and then leave it out for the rest of the season.
I had my first macaroni pie in 2 years the other day. It was good, but it's a treat, not a staple.
Yes, please. Okay. So you spoke about, I heard our caller there mention cassava. You mentioned breadfruit, and I've taken a really supreme liking. Tell us, in terms of the way you're doing breadfruit, because there are these breadfruit chips now. I'm not talking about in the package. I'm talking about like if you go to someone and they have these thin slices that they fry. Deborah's shaking her head.
We're not promoting fat. As a rule of thumb, if you can't remember anything else, just remember fat, flour, and sugar.
Flour, sugar.
The way I think of a currant slice, another worst thing you could invent, right? It's got all of them in abundance. Again, tastes great, but it's Christmas and birthdays only, right? And yet people will eat 2 at a sitting, right? So yes, if you can remember flour and you remember sugar, also remember fat. So frying stuff generally isn't a good idea. There's nothing wrong with adding a little bit of vegetable oil to something.
Is there a good way to fry?
Hello?
With as little oil as possible. That's
Hello?
if you're going to.
Oh yes, and we do have a caller on the line. We got carried away talking about the.
I'm still here.
Good.
I love to cook my cassava and then fry it. So he said no. Well, I know you're not supposed to use a lot of fat. Sometimes I use the sunflower, the low
low calorie.
Yeah, is that good, or just cut out the oil?
As little as possible. It would be better if you baked it, but even there you might drizzle a bit of oil over the top. That's not, a teaspoon or less of oil isn't really going to be a problem.
Any
but deep
specific
frying
type of oil?
is the absolute disaster.
Okay.
But vegetable oil, keep away from shortening and butter and stuff. Use the vegetable oil that's got fewer saturated fats.
Olive oil?
Olive oil is the best, but also the most expensive. But sunflower oil isn't far behind. It's a lot cheaper.
Okay, so what I will have to do then is just I do my cassava like in a little thick, like we call it in the hotel when you're doing it like a baton. And I would just, fry them, not in a lot of oil, but if you said that, then I will have to put them in the oven then and let them.
Try baking it.
Yes.
I mean, oven-baked vegetables. I mean, I live in St. George. I get fantastic vegetables.
There's something I want to ask you. I am on the borderline for diabetes, and I use bitter melon. You know what is bitter melon?
Yes.
Right. I use that, and that helped me very, very good. And I use something called fenugreek. So I want to know if...
You mean vinaigrette?
No, fenugreek.
We call it fenugreek.
Okay, I know it's that.
It's a powder that you use.
Okay. I'm learning something today.
It lowers glucose a bit, but no, that is not how... The way if you have pre-diabetes, the way you're going to stop yourself getting diabetes is to lose weight. And probably, I don't know, I can't see you because it's radio, I'm guessing you probably have to lose around 20 to 30 pounds.
I am 140-something.
And how tall are you?
5'4".
Okay, so you're not very tall, so for your weight, that's quite heavy. And I'm guessing, again, I can't see you on the radio, that most of your weight is that bit around the middle, around the belly, right?
Yes.
Right, that is the bit that's harmful. What we know is that fat tissue isn't just something that stops you getting your pants on. It's actually harmful. It produces chemicals which make you liable to get strokes and heart attacks, which are the number one killer of diabetics. Right? If you have diabetes, you're 3 to 5 times more likely to have a stroke or a heart attack. That's how we define diabetes, by the way, based on the risks of strokes and heart attacks. So losing that fat mass around the middle is vital. We have a program which is based heavily on using lentils and peas and no meat. Not a long-term program, but we get people to lose large quantities of weight. I lost 15 pounds in 6 weeks when I did it. Because obviously Deborah and I had to be some of the first to do it because we had to persuade the patients to do it. So we've all done it. We know it works. The trouble, they said, is not losing weight. It's keeping the weight off. And that's why we've been talking about the exercise and your general dietary maneuvers. But yes, you need to lose some weight. That is arguably better than any medication I can give you. The other thing you can do if you have pre-diabetes, and this is well researched and there's a lot of science behind it, is if you can do an average of 10 minutes walking a day. There was a study, it's 20 years old now, that showed that people in your position with pre-diabetes, you could take medication, you could take a walk, and the medications generally reduced the new onset diabetes by about a third. But people who could sustain a 20-minute walk on alternate days, or an average of 10 minutes a day, reduced their risk of getting diabetes by more than half. That is to say, your 10-minute walk is 1.5 times more potent than any medicine we have in our armamentarium to stop your diabetes progressing. Now, that doesn't mean you can't combine the diet and the exercise, but by definition, scientific studies try and look at one thing at a time so we can tease out the problem. But yes, somebody in your position needs to be walking every day, cutting down what I said, the fat, the sugar, and the flour, and you could quite realistically turn your pre-diabetes into not pre-diabetes, and pre-diabetes is, after all, a condition where you've got a 50% chance of getting diabetes within the next 10 years.
I take my bloods almost every day. I have a book, and I put the date, well, I don't go up. My blood sugar don't go over 6 and a little.
You don't need to do that. I don't recommend that. Those machines are not intended for that use. They're not sufficiently accurate.
Oh, okay.
So look at your waist size. The doctor can do blood tests which are much more accurate than anything you can do with your finger. But if you can take the advice about the diet and keep yourself walking, that's way more valuable. And look at your waist size. That's more useful in your case than what your blood sugar is.
And I don't really use sugar. It will have to be in something, but my tea I don't use sugar, and I use a lot of herbs like rosemary and singing nettle and all those things I drink as my teas.
All right, I want you to listen to Dr. Krimholtz, take his advice, and you will be on that course to better health and reducing your risk of becoming a diabetic. Of course, always a pleasure talking to you. We'll take a quick break here. The Pulse Radio Show brought to you by MedSafe Medical Supplies Limited.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmetts Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
I really want to thank Dr. Krimholtz and Nurse Deborah Knight for coming and sharing with us today. The information they have together is so important to help the public get on that path to better health. That's what we're really promoting this season on the Pulse Radio Show, as we help you with a number of conditions. Of course, today is diabetes. We are focusing on that. We have 2 callers on the line. Let's go to them very quickly before we talk about the diabetic foot, because that's another issue plaguing our nation. Good morning, caller. Welcome to the Pulse Radio Show. How can we help?
Yes, good morning. I just wanted to give some ideas, some things that I do for my diabetes. I do practice portion control, and I look at my glycemic content of the foods I eat. Like the good book says, everything in moderation, because practically everything turns into sugar. But for the people that like pasta, there's a pasta that's made from split peas. In your opinion, I do look at the glycemic content of it. I look at the glycemic content of everything I use. Would that be a good alternative?
It's better than pasta. In my opinion, it doesn't taste nearly as good. So I would tell you to have your pasta just once a year, rather than have
even if it's made from split peas.
Even if it's made from split peas, it's also, if I remember rightly, quite a lot more expensive. I
haven't seen it here. Right. I usually purchase it overseas.
Right. So the trouble with that, if it's come from overseas, remember I said don't eat anything in a packet? Chances are it's got additives to it to make its shelf life longer, which will stop you being full when you eat it. I'd honestly advise you to have the peas instead.
I look at everything that they put in the foods.
All right,
because I don't trust them.
A lot of those things you'll find very long words of things you would never have in your own kitchen. That's the definition of an ultra-processed food. So honestly, have the peas. Don't waste your money on imported goods. There, you can do your bit for the environment, cut down your carbon footprint as well. Have the peas, but don't have all those things with the additives.
And then Dr. Krimholtz said once a year you can enjoy the pasta.
You said moderation is more moderate than others.
I just use the one that's made with the peas, because I figure it would be more healthy.
It probably is, but I can't prove it to you. There are no studies.
Yes, I know, because you can't see what's in it. But I do check it out, and I use my herbs along with the other things that I eat, like the guava, the mango leaves. I find it strange that mango leaves is good for diabetes, but then if you eat too much of the mangoes,
hold on. Deborah and I were talking about this before we came in. Don't confuse herbs and leaves and bark or whatever with medication.
I know, I don't.
So there's a big, there is a big misconception out there that these things.
Teas.
Right. Come back to the first thing I said, which is that take your medication, because there's people out there who need medication.
Yes, I do take my medication.
That is way more important than what leaves you add to your food. I'm not saying it's bad.
I do take my medication. I don't play with diabetes.
Right. Let's make it clear.
I wouldn't wish it on my worst enemy.
Right. Let's make that clear, because there are people listening who may not have got that message. The medication is what matters. You're tinkering at the edges with those things. That's not going to help you that much. I'm not saying they're bad, but they're not as important as your medication and the rest of the food you're eating. Come back to it. Don't eat the pasta, and take your medications. little leaves and stuff may be nice, and I'm not saying you can't flavor your food with them, and I'm not saying they're necessarily bad, but I must not let anybody come away from this program thinking that that's an
they can
alternative to
do
medication.
without their medication. I wouldn't advise
But
that.
we see
either.
so many people who
Listen
believe
to your
that.
doctors.
Well, thank you very much for calling us and sharing what you do. But as you heard Dr. Krimholtz said, medication, priority number one, and controlling your portion sizes and eating right. The other important part of controlling your diabetes, and in some cases, when you add the exercise to that, you can help reverse it. You want to add something to that, Nurse Knight?
I have to add something here, because one of the major issues we have also in my clinic, the patients report that they either sip the mango leaf or they drink bush tea, and the bush tea and the cinnamon and all the other things they mix together is working. And I said, how do you know that? How much is actually in a tablespoon or a teaspoon of this herb you have mixed? I could tell you that if you take a tablet, you have a milligram head of strength, and I could tell you how it works. We're not disputing that they don't have some benefit. What we're stating is that we want you to take your medication consistently so you can see the benefits of the medication. And this is always a problem in our clinics. Patients go away thinking that the medication is doing them harm when the medication is actually being the most beneficial to them.
Indeed. Our next caller here on the Pulse Radio Show. How can we help?
Yeah, good morning, Shane.
Good morning. Hope you're well.
And the panel, the good doctor, and the nurse. I have two solutions. It sounds in all things, exercise is very important. And if you cannot exercise, then you got to eat healthy. And if you're eating healthy, the things that are healthy should be the cheapest things in the supermarket. We have our priorities wrong, and then we say we punching above our, the only way we are punching above it, like people get the doctors girly say it's fat, but we are punching above our weight.
Well, we have our auditor with what you're saying here. Well, to audit what you're saying here, Dr. Krimholtz, I'll let you chime in. Go ahead.
I don't agree that a healthy diet is necessarily a more expensive one. And we all had a discussion about what you're paying for breadfruit, and clearly that lady's paying too much for her breadfruit, isn't she?
Yeah.
But if you eat local vegetables and cut back, your meat is the most expensive stuff we eat, also the most dangerous and the most environmentally unfriendly. So get your vegetables, go to your local market. You don't even need to go to the supermarket, and you'll get fresh, well-priced, affordable produce. I'd really encourage you to do that. I don't agree with that statement that it's necessarily more expensive. Clearly, I'm not including all the cost of cooking the food and stuff, which I know can take longer. I'll certainly acknowledge that if you're having pulses and you're having ground provisions, it takes longer to cook than getting a hot dog at the gas station, but you're going to eat a whole lot better. The trouble with eating your hot dog at the gas station is you can eat one, and I'm amazed by what people put on top of it. When you have the pickle and you have the cheese and all that, and the mayonnaise and all those really horrible things that really are doing you no good at all. And the meat in the hot dog is probably a bit questionable anyway. And the bun, which is full of sugar. Have you ever tried to make a hamburger or a hot dog bun from scratch? Go look at the recipes on Google. You put in tablespoons of sugar. So eating those things, not only are they bad for you, but you're not going to feel full at the end of it, and you'll want to have a second one. And you'd probably have a soda with it, because they do have deals to encourage you to have a soda. So no, I know I'm asking you to work harder, but I am absolutely not asking you to spend more money on your diet to eat healthy.
Yeah, you go down to Cheapside Market. I know the vendors down there, they have affordable produce. You can also go to Eagle Hall. I know it might sound like an ad, but it really isn't. These are the areas you can get some affordable, and I'm speaking about St. Michael. That's where I live. I've lived most of my life, so I frequent
I'm a
those
convert
places.
to the St. George Farmers Market.
And then there's that. So you have options. Please explore your options, because at the end of the day, your health and the cost of spending on your health is really should be your priority. Because without health, the opposite and the the end result is not what we want. And we want to see less people coming into Nurse Knight's clinic. she wants to help everyone that comes, but we want to see less people coming there, and we want Dr. Krimholtz to say, well, look, we're seeing a reduction in the trends as far as diabetes is concerned across Barbados. That's what we want to hear. We have to speak about the diabetic foot and the problems that you're seeing with people coming to you, Dr. Krimholtz.
The hospital is teeming with people with diabetic foot problems. And there are a whole raft of reasons for that, and we know at our level at the hospital we're not doing a very good job. We're well aware of the outcomes of what happens with people with diabetic foot. The longest running data I have goes back to 2015, when I looked at all the people who had amputations in our hospital. 24% died in hospital, which is pretty bad, but 18 months later, less than 40% of people who'd had a major amputation were still alive. So when we nitpick about footwear, we are allowed to be obsessional because we see the appalling outcomes. I'm well aware of the hospital's tried to mitigate things. They've introduced a vascular surgeon, but as yet, she's not up and running with a full team and a full service. She only has one list a month. We haven't given her the resources she needs to be able to do what she can do. We have very limited radiology services. So, if there's a poor blood supply, which is always the problem in a diabetic foot, there's a lot that can be done, and yet we end up amputating because we don't really have the equipment and the skills to do it. So we know at our level there's more we can do, and we're very aware of it, and we're trying to do something about it.
Yeah.
But much more effective than that would be people not getting in trouble in the first place. You could not get simpler. We spend a lot of our time talking about footwear. We work with a footwear specialist in our clinic. Get yourself some shoes that are enclosed shoes and comfortable and sufficiently sturdy. They might cost more than slippers, but they'll last a whole lot longer, and actually they're cost effective. I bought this, everyone knows me about my clogs that I wear. I bought them in the hardware store. They cost me $300, and I wear them for absolutely everything. On the bicycle, on the boat, on the roof, in the garden, but they last about 3 years. And that works out at 30 cents a day for a really solid pair of shoes.
Wow.
And in addition to that, make sure you're wearing a pair of socks, cotton socks with those shoes. The cheapest insert you can buy is $5 for 3 pairs of socks that will stop your foot from rubbing, stop your foot from getting sweaty, because athlete's foot is endemic in this climate, so you don't get breaks in the skin. Footwear is a major part of it. There were studies shown here in Barbados that Henry Fraser and Anselm Hennis published showing your chance for an amputation, especially if you're a woman, is directly related to the footwear you have. And of course the women have the high-heeled shoes, which is the worst thing you could possibly wear. Sneakers and
problems. Dr. Krimholtz, I think you have caused a national problem there.
I hope we do, because we've got published data showing it. So I would encourage people to
So I want you
wear
to
safe
repeat
shoes.
it. High-heel shoes are bad for women.
Yes, they are terrible for women, especially if you have diabetes. Look, if you wear open-toed shoes and you walk through, I guarantee there's a piece of glass looking for your toe to cause that cut that you don't notice till it's infected. The second thing on the diabetic foot is check your feet every day. People with diabetes can't necessarily feel their feet. So check, and the obvious place is the bath, because you don't wear shoes and socks there. If there's a cut on your foot, for goodness sake, do something about it. Clean it, put on a Band-Aid, put on antiseptic. But if when you check the next day it's not obviously getting better, you better find your way to a doctor pretty darn quickly, because with antibiotics we can prevent these things from turning into major infections. And what everybody forgets is the time frame from cutting your foot to having an amputation can be a week or less. You haven't got time to sit on it and hang around for a bit and go and see your doctor next week. You have to deal with it urgently, and that is part of the problem. Our systems are not good at responding quickly to people who need their foot attended to rapidly. So it's up to patients to agitate and go and see a doctor urgently. Even if you have to pay to see a doctor, it could save you your foot and your life.
Indeed. The 2025 to 2028 strategy will address some of the deficiencies that we've seen over time at the hospital. So you can go and take a look at that. It is on our website and it is published widely as well. We will share it with the media so that they can tell you how you can more adequately see it, get your own copy, and really look at some of the improvements coming at our hospital. Deborah, you want to add something on this footwear? I know we have about 1 more minute left, but time flies so fast when we are sharing this information on the Pulse Radio Show. Go ahead, Deborah.
I just want to say that when you come to the outpatients clinic, particularly on Mondays, Wednesdays, and Fridays, you see the long lines of persons lining up to get dressings done. There are amputations, there are digits missing, and the majority of the patients indeed have diabetes. And if they had taken on wholeheartedly the foot care advice we give them every single day, checking their feet daily, inspecting, these things could have been avoided. So I agree with Dr. Krimholtz. Prevention is better than cure. Why not just take the time and just inspect your feet daily? It's easy.
It is easier than having the end result of having an amputation or, as you said, a digit missing. Dr. Krimholtz, as we wrap up the show today, final words, final bit of advice for our listeners.
Well, you've only given me a few seconds. So George Alberti famously said, eat less, walk more. But when I would add to that, if you're going to walk more, do your walking in some safe shoes so you're not going to have a problem.
Indeed. Final words, Nurse Knight?
All I want to say to the public of Barbados that diabetes is something that can be managed and managed effectively if you listened to informed persons.
To Dr. Krimholtz.
Informed persons.
Indeed. And of course, we want you to keep listening to us here on the Pulse Radio Show. You can check us out on our website, www.qhconnect.com. I can tell you by later today or early tomorrow, you will have access to this program. So if you missed anything, you can also listen back to Dr. Michael Krimholtz, our diabetes specialist doctor, leading doctor in the field, and he would have been the one responsible for setting up the diabetes clinic at our hospital. And of course, you will hear Nurse Deborah Knight, our diabetes specialist nurse, my good friend, always helping us to really share this information with you. Thank you, Kimberly, for producing the program. She has some recipes that she will share with me that I'll put on our website as well. They're healthy. So you can check those out there. And until next time, next week, our focus is on a special initiative between the Accident and Emergency Department and Urgent Cares across the country. So you can listen out for that and much more right here with us on the Pulse Radio Show. See you next time.
Thank you, Shane. The Pulse Radio Show brought to you with the kind compliments of MedSafe Medical Supplies.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.